Hi everyone, hope you are feeling healthy and things are going well for you, because here we are in full-on pandemic shutdown mode, and I know that life is full of a lot of uncertainties and things are really turned upside down right now. So I wanted to connect with a message and an update about how things are going here in the practice right now. In order to do our part and keep everyone protected and help out ease the burden on our healthcare system, I have moved the practice to all telehealth video sessions at this time. Now, I know what you may be thinking. Hooray, I get to avoid Atlanta traffic. Yes. And also, you may be thinking, I don't know about meeting with my therapist through video chat. I'm really more of a face-to-face, in-person kind of person. But let me put your mind at ease here. Of course, what you're saying makes sense. Face-to-face is great. But let me tell you that the telehealth video session is actually really easy to work with and really effective. I've found in my experience that the transition over happens really smoothly, and within a couple of minutes, people find that they adjust well. And usually the experience, and even some research has shown that once people have had their first session, they tend to end up feeling really better about it. It's just kind of something, we're used to video calling, we're used to video chatting, but doing this with a therapist is probably not something that we've done before. But I want to reassure you that things are kind of running smoothly here. We're doing our part to keep a kind of normal schedule, because I know things can be stressful at home. Being cooped up, family, kids, conflicts can kind of come up. Social isolation can be really difficult. So therapy is a place to try and maintain a bit of normalcy, try and get a bit of social connection through the social isolation measures right now. I have an update page over on the website at jareddefeif.com. If you look up in the menu, there's a COVID-19 update page that has info about what's going on and tips and tricks to get the best experience that you can out of telehealth. I'm looking forward to seeing all of you in a new setting, in a new way. We'll get back to kind of regular operations maybe in a few weeks or maybe even a little bit longer. And I look forward to meeting new folks in this way. You may be wondering about, do I get started now or should I hold off waiting? We may be here for maybe up to about 2 months, depending on how things go. There's no time like the present to get started, so I would be happy to meet with you virtually for the first time. Again, let me put your mind at ease that it is actually a really great way to meet. Even if you're not somebody who typically does video calls, I find the therapeutic process tends to go pretty well in these circumstances. There are updates on my website over at www.jareddefeif.com. If you look in the menu bar, there's a COVID-19 page with updates and how to use telehealth and some tips and pointers for how to make the best out of the experience. And of course, you can always email me and get in touch at info@jareddefeif.com. If you have any questions, I'd be happy to answer them. Hope you're hanging in there, and I look forward to seeing you around soon.